Okay guys, we've got space now. So in this section we're going to talk about hyponatremia when you've got osmolality that is less than 275. By definition, that is hypotonic hyponatremia. If you really want to understand hyponatremia, please go and study the basics of fluid compartments, how water moves from one compartment to another, because that's where it is. That's where it is. So what you do here, you find that your patient has got hypotonic hyponatremia. Here you take the urine and you do you check the concentration of sodium in the urine. The concentration of sodium in the urine, if it comes out it's more than 20 millimoles or it's less than 20 millimoles, it's telling you something. If the concentration of sodium in that spot urine, you don't have to do a 24-hour collection, that's just a spot sample. If the concentration of sodium in that urine is more than 20, it means that this is a renal loss. So this patient is losing their sodium through the kidneys. But if it's less than 20 millimoles, then it's not the kidneys, it's elsewhere. So it's not a renal loss. Alright? Okay. So more than 20 millimoles, it's a renal loss. Less than 20, it's not a renal loss. It's elsewhere. It could be the skin, the GIT, and all of that. So now the next thing that you need to figure out here is the hydration status of the patient. Hydration status of the patient. Is the patient hypovolemic? Is the patient euvolemic? Or is the patient fluid overloaded? Right? If the patient is hypovolemic, think about vomiting. That's a GI loss, right? Think about diarrhea, another GI loss. Think about skin losses. Okay. If your patient is fluid overloaded, think about your fluid overload states such as heart failure, such as liver cirrhosis, such as nephrotic syndrome, and etc. So So I said on one of my other videos that hyponatremia, not every time you're going to have to calculate osmolality. When you've been seeing these patients, you can kind of guess the cause of your hyponatremia, because if you've got hyponatremia and your patient has got one of these conditions, then you'll be like, okay, I have it because of heart failure, or your patient has been vomiting or having diarrhea or has been sweating a lot from whatever cause. Then you can be like, no, it's because of vomiting, the GIT losses basically. Okay, so for euvolemia, it can be things like hypothyroidism, hypocortisolism, hypocortisolinism, should say. It can be renal insufficiency. And. Okay, cool. So if you've got hyponatremia and you've got a concentration of sodium that is more than 20, then that's a renal loss. Things that can give you a renal loss are things like okay, there you also need to classify it first, just like here. Look at the fluid status of the patient again. Is the patient hypovolemic, or is the patient euvolemic? Right? Is the patient hypovolemic? Is the patient euvolemic? If the patient is hypovolemic, you can think about SIATH, you can think about diuretics, Addison's disease, Addison's disease,